How are you feeling with PD classes?
I am feeling very good with PT classes. I am feeling very confident now.
Okay. So what else do you feel like previously when you joined before and now? What changes you saw?
Yeah, before I was not confident. I was unable to answer some questions. I was not ready and I was not prepared. After giving interview and after taking your lecture, Dr. Manoj Sharma sir lectures, I am feeling very, very much confident. And right now I am very confident for my interview and I am ready for my interview to give it in a better way.
So Dr. Kushal, first of all, I want you should tell me what you learn in your interns.
Thank you, sir. Thank you for asking this question. I have learned many things in my internship. First of all, I was posted in the Ops department where I got to know the new things. Where I have conducted 2 to 3 deliveries, which are normal deliveries and cesarean sections also. And I did all the investigation routine checkups. After that, I got posted to emergency department where I handled and managed some cases of trauma, myocardial infarction, cardiac arrest. We got the non-clinical postings like PSM where we got into the 3 other villages where we went to the rural areas and served the people where we got to know the new cases and different cases of rural areas and differential diagnosis and different investigations. We got to explore new things for us.
You told about MI cases. Tell me the management of MI.
Okay. MI is also known as myocardial infarction. It is of 2 types. ST elevated myocardial infection and infarction and non-ST elevated myocardial infarction. For ST elevated infarction, we will do ECG and then we will check for the ST segment elevation or T-shaped curve depression. In that disease, we will give for first of all we will give the emergency help, whatever the fluid and all things are needed. After that, we will give the drugs that which like reduce the morphine, and morphine will be reducing the pain, and we will give it for the chest pain. We will give uh, the GTN, and after that, after giving the GTN, we will give the blood thinners, aspirin, and clopidogrel combinations.
Okay, now you tell me what is your favorite medicine, emergency, PTA, ENT,
I have done
ophthalm?
I've done work with all the departments, but Ops is my favorite.
So tell me about gestational diabetes.
Okay, I will tell you about in brief gestational diabetes. It is diabetes which occurs during the pregnancy, which is the blood glucose level of more than 140 by mg/dl in the pregnancy. It can be diagnosed early in the pregnancy by ANC visits, by DIPSI test, or oral glucose tolerance test. Where patient given as 75 mg oral glucose, and after 2 hours the glucose is tested. If the level is more than 140, it is called as gestational diabetes. If it is more than 200, it is also known as the over diabetes.
See, doctor, you might have studied in your college different subjects. What else you did in your college? Means how was your college life?
Okay. I want to tell you about my college life. First of all, I went to a new place which is also known as Karad, where I got to learn a new language which is Marathi. We tried some new food, made new friends, and also in the second year I was elected as the sports secretary of my college, where I represented college in many events, cricket, volleyball, and I conducted all the events of my college and represented in I also represented my played at cricket in district level also.
Okay, you stated you know Marathi. Give me your introduction in Marathi.
मला नाम कुशाल राजपुरोहित आहे. मी जोधपूर पण आहे आणि मी कॉलेज पण होते. माझं कॉलेज नाम कृष्णा इन्स्टिट्यूट ऑफ मेडिकल सायन्स होते. कराड मधला होते. I know a little bit.
Okay.
And right now I am like it's been 1.5 years. So with the I came back to Rajasthan again, and like I'm not interacting with the Marathi people, so like it is not that good right now.
Okay, tell me about breast bleeding.
Breast bleeding. Breast bleeding can be defined due to the various disorder. Mainly, generally, it can be due to the breast carcinoma, breast lump. It can be also known as PUD orange, which is like orange color secretions, which can be seen in the breast carcinoma, breast fibroid, and other cases. It can be due to fibroadenoma and other cases.
Okay. Tell me about restless leg syndrome.
Okay. Restless leg syndrome, in which the patient, when it is admitted to the patient, it shakes his legs continuously, or whenever he sits at home, he shakes his legs continuously without like it is kind of a tremor which can be reduced only by giving the sedatives. It is continuous movement. Basically, it is a continuous movement of the leg.
Tell me the indication of C-section.
Okay, it can be many indications of the C-section. First of all, it can be due to eclampsia, preeclampsia, polyhydramnios, uh, abortion, ectopic pregnancy, molar pregnancy, and gestational diabetes also. These are some cases which are suggestive of cesarean sections.
Okay. Pulmonary embolism.
Okay. Pulmonary embolism is a case of a lung disease in which the fluid inside the lung cavity is filled. More than 150 ml of fluid is if it is inside the lung, it has to be aspirated because it mainly patient comes with the problem of shortness of breath, dyspnea. After that, we will first do the investigation. We will do the chest X-ray, CT, in which we get to know the definite location of that pulmonary embolism site. After that, we will do the incision and ICD, intercostal drainage of the embolism. It can be due to general trauma also. It can be due to road accidents also. Mainly, we will do the intercostal drainage at the fifth intercostal rib in the mid clavicular line.
Tell me about pulmonary edema.
Okay. Pulmonary edema, it is a condition which can be described by the increased blood pressure. Mainly the fluid is filled in the body cavities, which can lead to the shortening of the nerves, constriction of the nerve, which leads to it can be fatal, which can lead to the patient's death. First, we will identify the blood pressure. We will do the initial investigation. Patient come with the dyspnea, breathlessness, and other symptoms. We will investigate the patient. By doing first, we will do the chest X-ray. We will do the fluid test, and after that, we will do the CT. If diagnosed properly, then we will manage the patient by giving the proper drugs which eliminate the water inside the body, which relieves the edema.
Whatever question I'm asking from AMC has asked recent days.
Okay, okay. Yes, sir.
How are you feeling with PD classes?
I am feeling very good with PD classes. I am feeling very confident now.
Okay. So what else do you feel like previously when you joined before and now? What changes you saw?
Yeah, before I was not confident. I was unable to answer some questions. I was not ready and I was not prepared. After giving interview and after taking your lecture, Dr. Manoj Sharma sir lectures, I am feeling very much confident. And right now, I am very confident for my interview, and I am ready for my interview to like give it in a better way.
Okay. We tried our every class to make it dynamic, like whether it is personal question, whether it is professional questions, whether it is body language or medical or introduction. Which one is
Yes,
your
sir.
favorite and why?
My favorite is like whenever you take my interview, it is my favorite part. I like to answer questions,
You like the
and
mock interview class,
it improves my confidence.
right?
It is one-to-one interaction. It is improves my confidence, and I like to answer every question. And if by chance I do not answer any question, you guide me very well to how to answer that question. What questions are asked recently? You update me every day to go throughout these questions, which helps me a lot.
Right. Okay. Now you tell me about organochloride poisoning.
Organochloride poisoning. It is something new. I haven't read about it. Actually, I know about
Every time I
organophosphorus.
will not ask about scorpion bite, dog bite, snake bite, cat bite.
No, no, sir. It is not like it is a new thing. I heard about organophosphorus poisoning, but organochloride
One of
poisoning is
my
something.
girl student was asked sulfas poisoning. Can you speak on that? Recently asked in AMC,
Yeah, I can tell you something about
right?
that. Sulfur,
Right.
sulfur actually is a drug which is used as a preservative for like wheat, maize, bajra. If it is consumed with the food, it can lead to the agitations and pulse up, increase in the pulse, increase in the pupil constrictions, which can lead to the major symptoms. And after that, we have to do the gastric lavage for that poisoning, and we have to give the proper drugs. If we are unable to manage it like on time, it will lead to like many consequences, which lead to the brain effects. It can, if it accumulated in the brain, it can lead to the many disorgan movement and very various symptoms like dyslexia and different vomiting, nausea, and other symptoms like.
Name Culex bone diseases.
Okay, Culex bone diseases. Culex can be filariasis, Kala Azar. I remember these two right now.
Okay, now name waterborne diseases.
There are very many waterborne diseases. First of all, the most common it is diarrhea. Second, it can be Escherichia coli infections. Third, it can be amoebiasis. Fourth, it can be amoebic dysentery. Fifth, it can be uh, pyle, and amoeba histolytica infection. I remember these five.
Tell me fever with jaundice, differential diagnosis.
Fever with jaundice, differential diagnosis. Okay. Fever can be along with the typhoid fever. Fever with jaundice can be seen with the hepatosplenomegaly. Fever with jaundice can be seen in the acute hepatic failure. Jaundice can be seen in splenic rupture. Fever with jaundice can be seen in any abdominal related acute condition which can lead to the yellowishness of the fluid, yellowishness of the urine, which can lead to increase in the ALT, AST.
Now tell me about leptospirosis treatment.
Leptospiral. Right now, I'm unable to recall the treatment. I It is a new question to me. I haven't prepared it.
How will you monitor TB patient who is on TB drugs?
Okay, there is a scheme called as Nikshay, and for monitoring the TB patient, there is a scheme called DOTS also. Nikshay is a government scheme in which the patient is also given an incentive of 500 rupees per month. And for traveling purpose, he has to be given 750 rupees per month. There are some Nikshay friends which are awarded like 5,000 rupees per month. They are in the working state. They go to the rural area and ask the TB patients to take medicines daily, and they observe them. And there is also a DOTS program in which direct observe treatment short course program. It is a very short course program which is given for the TB patient, in which healthcare's initiative provide the beneficiaries and all the drugs. They are managing the conditions, and they assess all the drugs that has to be taken daily or weekly.
Tell about scrotal swelling.
Okay, scrotal swelling can be due to hernia. Mainly, it can be due to inguinal hernia, direct hernia, femoral hernia, and except hernia, it can be due to hydrocele. It can be due to hypospadias. It can be due to umbilical ureter filling. It can be due to ureter swelling. These are the cases which lead to the scrotal swelling.
Definition of MDR TB and XDR TB.
Okay. MDR TB is also known as multi-drug resistant TB. When the patient of TB is given as treatment as with the various drugs, the patient became resistant to the multiple drugs like isoniazid, rifampicin. Those drug therapies changed.
Okay.
That is known as MDR therapy. XDR therapy is exclusive therapy which the patient does not react to the primary drugs. The patient is given a different treatment. Only one of the primary drugs given, along with that one fluoroquinolone is given, and after fluoroquinolone, some antibiotics are given with the treatment that is known as XDRTB.
Tell about Swachh Bharat.
Okay, Swachh Bharat Abhiyan is created by our Honorable PM Narendra Modi ji. It is a abhiyan which is related to the cleaning of houses, roads, and cities, and whole the countries of India, whole the country. It is implemented to maintain the hygiene, mainly to clean the hygiene, to make toilets in the every area of the every corner. So to promote the sanity and hygiene, the Narendra Modi ji created has this program.
Wonderful, wonderful. Okay, TB, first line drugs.
Okay, there are 5 first line drugs that are known as isoniazid, rifampicin, pyrazinamide, ethambutol, and sulfasalazine, HRZDS. These are first line drugs.
Aortic dissection.
Aortic dissection. It is a heart condition which leads to the combination of two arteries, which is like pulmonary artery along with the aortic arch. It can be due. It can also called as aortic dissection. Why it is called as aortic dissection? Because it is like mixing of the blood happens inside the heart, which leads to the mixing of oxygenated blood with deoxygenated blood, which leads to the decrease in the blood flow, and decrease in the respiratory rate, decrease in the pulse, which many symptoms like that.
Tell about hypochloremia.
Hypochloremia. Hypochloremia condition to be defined as the chlorine condition which in the body which have the low amount of the chlorine. It can be due to the low levels of the chlorine. Either it is due to the more secreted amount in the urine, or it is more excreted in the urine, which leads to the hypochloremia. Generally, chlorine levels are not essentially required, but chlorines are mainly combined with the sodium to form the channels so that they can transport the various things in the body, various fluids in the body. Sorry.
Tell about ventral hernia.
Ventral hernia. Okay. Ventral hernia either from also known as front-sided hernia. It can also known as direct hernia. It is not through the inguinal ring. It is directly going through the ischial fossa and directly entering to the inguinal canal, which leads to the hernia, which is also known as direct hernia or ventral hernia.
Tell about femoral IV line procedure.
Femoral IV line procedure. I have to recall that procedure, but I know little bit about it. First of all, for femoral vein procedure, first of all, we will take the catheter like 14 to 22 gauge line. We insert the needle, clear the area where we have to puncture. Then after that, we will do the puncture and in the femoral vein, and the femoral vein directly came to the inferior vena cava to directly to the that connect to the heart. That is femoral vein puncture, I think. I have to read more about it right now. I am not knowing about it. It is only thing, the small thing I know.
Although you answered very well, yeah. Nice. Fat soluble vitamins. Have I asked this question?
No, you haven't asked.
Name few fat soluble vitamins.
Vitamin A, D, E, and K. These are fat soluble vitamins.
Okay, tell about pain in right iliac fossa. Differential diagnosis.
Okay. Pain in right iliac fossa can be due to the femur fracture, intertrochanteric fracture. It can be due to the inguinal hernia also. It can be due to the splenic rupture. It can be due to stones, ball stones. It can be due to ureteric stones. It can be due to bladder injury. These are the some cases of.
Okay. Now you tell about fever with hepatosplenomegaly. Differential diagnosis.
Fever with splenohepatomegaly can be differentially diagnosis as like mostly it is in the jaundice, obstructive jaundice,
Obvious, hepato.
and it can be in some of the diseases. I don't remember the name, but there are 3 to 4 diseases which are specific to the hepatosplenomegaly with fever.
Okay. What are the complications of hepatitis?
Complications of hepatitis. It can lead to the liver enlargement.
Hmm.
It can lead to the liver abscess. It can lead to the liver rupture. It can occlude the portal vein also. It can be included in the liver with the other organs communication, which leads to the necrosis of the other side organs.
What are the side effects of streptomycin?
What are the?
Side effects of
So please repeat.
streptomycin.
Okay. These are the drugs which are comes in the category of aminoglycoside, streptomycin. This can be given as the also known as the macrolides. These are given under the treatment. Side effects can be ototoxicity, nephrotoxicity, hepatotoxicity.
Black, tarry stools, burning, crawling, itching, numbness,
Okay, these are basic.
tingling, feeling, chest pain, clumsiness, dizziness, and
Okay.
feeling of constant movement of self, surroundings.
Okay.
Wonderful. Good interview. Answered almost more than 80%.